Insist on parental health screening. Whether you're opting for a pedigree or crossbreed, all breeding parents should be health screened. Contrary to popular belief, labradoodles actually require more testing than pure breeds. There are 3 to 6 breeds infused into the gene pool of an Australian cocker dog, so all the diseases affecting each of these breeds needs to be tested. Vet checks give you peace of mind, whilst DNA testing can actually eliminate certain hereditary problems by identifying the clear, carrier and affected lines. All of our parents have a veterinary health check annually. Pups have a minimum of 2 vet checks for their vaccines pre-adoption. Of course, they're checked prior to neutering. In order to assess our breeding lines for structural problems and to reduce the risk of producing a puppy with hip, elbow or knee problems, we screen extensively. We use either the BVA or OFA schemes for hip and elbow dysplasia. Our vet performs the patella check as well as heart and general health checks. Most importantly, we check parent dogs with 36 DNA tests, covering 7 main categories from musculoskeletal to neurological diseases. Many of these genetic problems are life-altering and several are even life-threatening. Genetic basics. Genetic testing is the examination of the genetic information on an individual dog. Genetic testing can eliminate the risk of affected puppies, providing that the breeder identifies the status of each parent and then combines lines to breed out the diseases from future generations. Genes are transmitted from parent to offspring, so a dog inherits 1 copy of the gene from dad and 1 copy from mum. These are called alleles. Genes can be dominant or recessive. Alleles can be heterozygous when different copies are inherited, or homozygous when the same copy is inherited. Let's do a little exercise to understand how inheritance works using exercise-induced collapse, EIC. EIC is an inherited condition that affects Labrador retrievers and related breeds and crossbreeds. EIC is recessive, so 2 copies of the allele need to be inherited for the disease to be expressed. A normal dog who does not have the mutation in the gene for the disease will have the genetic makeup of N, so NN, 2 normal copies of the gene. What happens when we breed this dog to another healthy dog? Clear to clear. 100% of the offspring will be clear. Now let's say we kept one of the male puppies from this litter. Once an adult, this offspring, who is NN, is bred to a girl who is known to have episodes of EIC. So we know her genetic makeup is EIC. You may be surprised to learn that even though one of the parents is affected by the disease, none of the puppies will show symptoms because the puppies have inherited 2 different copies of EIC, which makes them heterozygous, also known as carriers. There are 3 options: carrier to affected. When bred to an affected mate, half the litter is affected by the disease, having received 2 defective copies of the gene. The other half are carriers. Whilst they can't show symptoms, they do carry the mutated gene. No clear offspring is possible, but a breeder could test and select only the carriers then to continue the breeding. However, it is essential as a puppy purchaser that you know if you're buying that affected offspring. Carrier to carrier. Each parent is a carrier. When 2 carriers are mated, 25% of the litter will inherit the mutated gene from both parents. 50% of the litter will be carriers and 25% will be clear, having received normal copies of the gene. Obviously, the breeder of this combination will want to screen the offspring to select the clear puppies. Again, purchasers should be given the opportunity to make an informed choice whether they want to adopt an affected puppy in the litter. Carrier to clear. When bred to a clear dog, then all the offspring will appear healthy without any symptoms of EIC. However, half the litter is clear, having inherited the normal copies of the gene, and the 50% are carriers of the gene. We believe if a genetic test is available, there is really no excuse risking an affected puppy, which is why we perform 36 of the DNA tests. We screen all our breeding dogs, both genetically and structurally. Structural testing is the visual and physical examination of a dog performed by manual tests and x-rays. It reduces but does not eliminate the risk of breeding affected puppies and aids in our selection of future breeding dogs. Hip screening. There are 2 schemes we use for screening hips: British Veterinary Association, BVA, and the Orthopaedic Foundation for Animals, OFA. Elbow screening. We use the same schemes to assess elbows. BVA use a grading system of 0 to 3 for each elbow, with 0 being a clear, non-dysplastic elbow, through to 3 being severely dysplastic. OFA uses either negative or graded 1 to 3. They also identify the presence of osteochondrosis and degenerative joint disease. Patella screening. Luxating or slipping patellas can be a really painful condition, which often requires surgical correction. The BVA does not currently offer a test for patellas, but the OFA have a scheme where the luxation, if present, is graded from 1 to 4, grade 4 being permanently slipped. The patellas are examined and graded by a veterinary surgeon. As breeders, we can reduce but not eliminate structural risks. Exercise, nutrition and environment, such as stairs, all play an important part in long-term health. Whatever breed you decide, make sure you choose a responsible breeder who invests time and money in health screening to ensure that they produce happy, healthy pups. Unfortunately, there are still diseases and disorders for which there is no genetic screening test. So, as with all breeding, health is not a guarantee. To request our health screening handout for free, simply email lisa@labradoodles.co.uk or visit our website www.labradoodles.co.uk. We have been breeding and training Labradoodles since 2003 with a focus on health and temperament. Email lisa@labradoodles.co.uk to join our waiting list for a puppy or partly trained Australian Cocker dog.